So good morning, everyone. I'll be covering the wet lab or a skill lab training. Now, why this is important, as Professor Sandeep sir has already told, it's very important whenever a resident who comes to join the ophthalmology, he is not aware about the surgical challenges because these are different from a routine surgical practice. You have to operate under microscope. You have to have a very good hand-eye coordination. You have to have ambidexterity. So these things are very, very important. And if resident is directly honing his skills onto a live patient or a human patient, so it may be very difficult for him to be stress free, as well as he may have a lot of issues. He may cause a lot of damage to the patient rather than causing a benefit. So it is very important to enhance three aspects as far as the surgical skills are concerned. One is psychomotor skill, other is hand eye coordination, and third is ambidexterity. And these can be improved by using a skill lab or a wet lab training when the residents joins the ophthalmology as a PG resident. Now you don't need a huge setup. Minimum you should have a 10 feet by 10 feet room in which you can have a simulator. You can have a wet lab center on a table on the side, and you need few instruments or few other setups which I'll discuss in detail. As I think most of us have done, we used to procure the eyes for our wet lab from our nearest butcheries. These could be either the goat's eyes, and nowadays you may not even get a goat eyes, but there are some phaco eyes which are already available in the market, which can be utilized as a replacement for these goat's eyes. There are various setups which you can plan in your skill lab. If you want the hardness of the nucleus to increase, there is a solution which is known as Karnowski solution. So once it is injected, if you inject it say within 5 to 10 minutes, the nuclear grade changes. Basically it leads to hardness of the nucleus by coagulation of the lens proteins. So within 5 to 10 minutes it is as good as a nucleus sclerosis grade 2, and within about 20 to 25 minutes the hardness increases to nucleus sclerosis 4 or 5. Another thing you can do is you can do a you can microwave the human nucleus which has been taken out maybe after ICCE. So that can also be used, and you can practice your phaco skills on that nucleus. So but with the availability of phaco eyes, you may not require these goat eyes, because these eyes are as good as human eyes. Now once you have these things available, you need to fixate these eyeballs. How do you do it? The cheapest way is you can use a styrofoam head in which you can make a socket in which these eyes can be fixed. The only problem is, yes, it is low cost, but it lacks stability. So whenever you start doing the surgery, so these move quite a bit. So once the stability is not there, due to manipulation it moves, and it may be difficult for initial practicing of these skills. Another thing available is a Mendel practice eye mount. Now this Mendel practice eye mount, again this is eyeball fixating device. It has a syringe and a clamp mechanism to maintain the globe fixation. The plastic eye holder is implanted in the center of this plexiglass mount. So this is also available freely in the market, and most of vendors have it. It is connected to a syringe via plastic tube with a clamp which helps to maintain a suction throughout. So it gives a very good stability, but the only disadvantage with this is it doesn't give that feel of a since it is a flat mount, so the resident may not get a feel how to operate on a human head. That feel is not available. So it does not simulate the correct hand positioning because it's a flat mount. The other thing available is a eye stand plus. This is a eyeball stand with a fixation head. Now you can see the eye. This is the eye stand on the one side, and other side is a fixation head. This eye stand can be mounted in the fixation head, and you can use a phaco eye in this. And with the phaco eye, now you can see that this eye stand is mounted in the fixation head, and the phaco eye is mounted on that in the eye stand. And in the phaco eye, you can perform all the procedures. You can perform a rhexis, you can perform nucleotomy techniques. So these all these surgical skills can be improved by using these phaco eyes. So you can do a, so this is a divide and conquer being done. Nucleus is being broken into various pieces. You can, this gives a realistic feel as it is in a actual surgery. So by using this, and I think phaco eyes comes as a pack of 10, and cost is also not very high. So these can be utilized. You can implant an IOL also into this. So this will give a complete feeling of a complete surgery for a resident. So he can improve all his hand-eye coordination and the surgical skills, nucleotomy techniques, intraocular lens implantation. All those techniques can be improved by using this. Then there are some vacuum assisted glow fixation devices. One is known as spring action apparatus for fixation of eyeball. Again, they provide a very good stability in this. Even the goat eyes or those, everything can be fixed and also mounted in a head. So that also gives a realistic feel where you can do the rexis, where you can do the nucleus expression, and also the suturing practices can be done. Similarly, so even if you want to do a cornea wet lab, for that also you can use the corneas which are not utilized for the research purpose. You can mount that on an artificial anterior chamber. You can also use the various types of microkeratome to cut the corneas. You can remove the descemetes and practice a DMEC procedures in these. And so these setups can also be included to have a feel how the corneal transplants and how these things are done. Then there are simulator based training, although this will be covered by Dr. Srishti in the next talk. Various types of simulators are available. The IC surgical simulator, which was with the Haag Street. So in this, various protocols are available, how the resident can improve the surgical skills, how he can monitor his progression over a period of time. All those things can be done. The other, in addition to IC surgical or a Haag Street simulator, there are micro Viz touch simulator and also a phaco vision simulators. Multiple are available. So these will be discussed in detail. The next thing I would also like to tell that suturing practice is again very important for all the residents to improve. You can use the various things, either you can use a 10-0 base and you can mark it in the way you want to suture, and that practice has to be done. Similarly, a banana can be marked within a laceration, can be marked, and that can be sutured. So all these things should be practiced in the skill lab to improve the surgical skills which you require, which everyone require during the surgery at some time or the other. Also, there are some devices available. For example, in the last photograph, you can see practicing for the applanation tonometry. This is an eye which is mounted on the slit lamp, and you can practice applanation tonometry. Similarly, for indirect ophthalmoscopy, for using the for lasering, using the laser in the retina, various types of protocols. All those things are available, and they can also be planned in the skill lab. So, thank you very much.
Thank you, Vijay. So all of us know once we go upgrade ourselves from the skills lab, we have to go to the OT. So I request now Professor Bandopadhyay to come and have his talk, which is basically training while in OT and assisting.